running yesterday.
Correct.
Yesterday you went running?
Yes.
And how was that compared to before getting adjusted or treated?
Sure. So, so normally after a few minutes of running, like even warming up, I start to feel tightness in my lower back, and then I'm like, oh gosh, this isn't going to be fun. But yesterday I ran 2.5 miles, and I didn't stop. I didn't feel any lower pain.
Good morning, Baltimore. It's Dr. Jeff Kalkstein with Kalkstein Chiropractic, your Baltimore area chiropractor, and I'm with Lauren this morning.
Hi.
Lauren, where are you from originally?
I'm from Baltimore, Maryland.
And
from
where do you live now?
But I live in New Orleans. I'm here visiting family.
Family, yes, okay. And you had never been to a chiropractor before?
No.
No, first time?
Yes, yeah.
How'd you get referred to us?
I just looked up best chiropractors in Baltimore, and you came up on Google.
On Google.
Yeah.
So you found Mr. Google, Dr.
Yes,
Google.
Dr. Google.
Or Mrs. Google.
Yeah.
It depends, right?
Yeah.
And what was motivating you looking for the best chiropractor?
I just had lower back pain. I started running, and so the lower back pain was preventing me from really feeling good about running and working out.
So it was interfering with your ability to run. How
Correct.
long had it been going on for?
For a few months.
A few months?
Yeah. So I just thought it was normal because running hurts generally.
It hurts you generally?
Yes, yeah.
Has it always hurt you in general?
No,
Just more recently?
Okay.
Okay. Had it interfered with any of their daily activities?
I just noticed, like, if I'm standing up for a long time, and I've been cooking a lot during quarantine and sitting down a lot during quarantine, just noticed more stiffness.
More stiffness?
Yeah, in my lower back.
Was there any discomfort, pain, numbness radiating down into your lower extremity, the left or right leg?
Yes, if I go running.
Okay, and where did you where did you feel that?
It started in my arches and my feet, and then went up to my shins and my knees, and then my lower back.
So the front of your leg, not the back of the leg. The calves weren't tight or anything?
No, the calf is the back of the legs.
The back of the legs. Okay.
Yep.
And so yesterday was your first visit.
Tuesday. It was like 2
Tuesday,
days ago.
2 days ago. Okay.
Yep.
And during that visit, we talked about your issues, well, just like we're talking about right now.
Correct.
We
Yeah.
examined you.
Yes.
And how did you find that exam?
It was good. It was really informative. It was educational. You were very friendly, and we talked about high school, which was great. So.
That's awesome. That's awesome.
Yeah.
And then what did we do after we examined you?
We talked about different exercises and stretches to do, and that's what I did. And
So we showed you some exercises?
Correct, yeah.
And then we adjusted you.
Correct, yes.
And what would you call that technique?
It just clicked.
It cracked.
It cracked.
Yeah. Everyone loves the crack in the video world.
Yeah.
So and then what got me all excited was first time in, you went running yesterday.
Correct.
Yesterday you went running?
Yes.
And how was that compared to before getting adjusted or treated?
Sure. So so normally after a few minutes of running, like even warming up, I start to feel tightness in my lower back, and then I'm like, oh gosh, this isn't going to be fun. But yesterday I ran 2.5 miles, and I didn't stop. I didn't feel any lower pain. And then normally when I feel lower pain, I feel like I have to stretch my lower back. I didn't feel the need to stop to do that, which was really great.
It's really nice.
Yeah,
It's nice, yeah.
It was really nice.
So it was something that you hadn't been able to do for a long time?
Correct, yeah.
Okay, all right. And so you did your exercises already today?
Yeah, I did my exercises, did my stretching.
Okay.
You had also recommended to get some orthotics. So I got that, and I did some stretching before running. So it was comprehensive.
And we did that because she had significant pronation. Her feet were rolling in, right? We wanted to create a little better stability while she was running. Where'd you get your orthotics from?
I did at Dr. Scholl's. They have like you put in your, answers to a questionnaire, and then they give you some
options.
Yes.
Beautiful, beautiful.
Yep.
All right, well, let's hop up here on the table.
Sure.
Let's adjust you, okay?
Okay. Should I go?
Yeah, we're gonna go.
Last time?
Yeah, just like we did last time.
Okay.
And then go ahead and begin. Were you surprised at the results?
Yes, I was really surprised.
Yeah, that's exciting.
Yeah.
And I think it all has to do with getting better motion.
Mm-hmm. Yeah, the stretching I think helps.
Yes,
too.
yes. It's a combination of issues. It was one of those exercises where we had you bending backwards.
Correct, yeah.
Yeah.
Mm-hmm.
And you relax that right like that. And I want you to let this loose. I'm going to tap you on your hip a little bit. Beautiful. On your back for me. That doesn't hurt, does it?
No. more surprising than anything else.
So refresh my memory, how long are you in town for?
So I'm here for about a month.
A month, okay.
Yeah.
So on your side towards me.
Uh-huh.
And I think what will be interesting to note too is how it affects your ability to sit for any length of time.
Correct,
and
yeah.
stand too, okay?
Yep.
And I think what's important also is not only do we want to teach you an exercise to do to help decrease your pain,
Right.
which in this case is the backward bending or the McKenzie lumbar
Right.
spine extension program we use. And I think the next thing to do is get you to the point where we can create some more core stability,
Yeah.
which is going to create a great foundation for you to continue to run
Right.
and maybe do some strength training. I think we can mix that in there
Yeah.
too,
Yeah.
right?
Yeah.
And then I think you'll really have some results. So 80% of these things we're going to teach you how to do, and you can do them on your own.
Yeah.
Okay.
Yeah. That's part of the reason why I came in too. Like, what can I do to help myself?
To help you, right, right. And then again, tap on the hip, let it go. Beautiful. That's on your back for me. So the next thing I'm going to do is I'm just going to give your legs a little tug, all right? And relax. And again, the other side, relax. Beautiful. Good job.
Great.
All right. So scoot up a little bit. You just bring your legs. There you go. Now, on the table, will find your feet.
Okay. All right.
Great. That's fantastic.
Cool.
So, go ahead and stand up for me. Anything else you want to share with Baltimore?
No, this is really, it's been a great experience, and even though I'm here for a short time, when I do come back, I'm going to come visit.
Yeah, and I think what we'll do is we'll reach out down to New Orleans. We'll try to find someone
Yeah.
who practices like this. You know,
Yeah.
there's a group of Major League Baseball chiropractors
Cool.
in the country. We'll see if there's a minor league facility down there,
Yeah.
or we'll reach out maybe even to the Saints chiropractor
Yeah,
for you.
that
okay?
sounds wonderful.
We'll make that
Thank you.
connection for you. All right.
Awesome.
Thank you, Baltimore.